Welcome to Study Time, a televised home learning program produced by Rwanda Education Board.
Hello student, a very warm welcome to the TV learning program. I'm your teacher Herbert, and I will be taking you through the biology and health science of senior 2. And we are still on the same unit, which is unit 9, which is concerning about gaseous exchange in human and in plants. Student, we are going to have lesson 3. And lesson 3, we're going to discuss about respiratory diseases that attacks the respiratory system. On the last lesson, which was lesson 2, we discussed about the breathing mechanism. I think everybody, you do remember the process of breathing. We talked about inhalation. We talked about, we said inhalation, sometimes it is referred inspiration, taking in air. And we talked about expiration or exhalation. Exhalation, that is breathing out, breathing in and breathing out, breathing in and breathing out. We talked about that mechanism. And we talked about some of the parts and structures because we mentioned that the lungs is a thin wall and has no special organs, but the lungs also is being facilitated for the oxygen to be taken into the lungs. I do remember we talked about some of the parts that are involved in breathing mechanism. We talked about the ribs, rib cage. We talked about the diaphragm. We talked about the external and internal intercostal muscles, how they do relax and contract. All right? And we talked about the volume of the lungs when the atmospheric, talked about comparison of atmospheric pressure and pressure within the lungs. And we discussed the detailed process of breathing mechanism. And we said, once you are doing inhalation, when you are breathing in, automatically what happens to the muscles of the lungs. We talked about the diaphragm moves down, and the rib cage move up and outwards. We talked about the internal intercostal muscles, they contract, but the internal intercostal muscles, they relax. That was and we talked about the pressure inside the lungs decreases and volume increases. And that one causes the air to rush from atmospheric pressure where it is in high concentration and moves into the lungs. For the case of exhalation, we talked about the external intercostal muscles, they relax. The internal one, they contract. We said the diaphragm, it regains its dome-shaped structure. All right? We talked about the rib cage. They move downward, not upward. They move downward when you're doing exhalation. So these are the breathing mechanism, and talked about the structure of alveolar sac, how it plays a role in the breathing mechanism. So let's talk about now our lesson of today, which is concerning identifying the common respiratory diseases, and we suggest the way of preventing these respiratory diseases and even their treatment. I know some of you these days, most of the whole world is being affected by a coronavirus, which is COVID-19. And we mentioned that COVID, most of the time, it attacks the respiratory system. When it attacks the respiratory system, and now breathing becomes to be a problem in that way. So now we're going to discuss some of these respiratory diseases that normally attacks our respiratory system, where also COVID is also involved. One of the diseases, however much is not mentioned in my lesson, but it also attacks the respiratory system. All right? Let's go through and talk about diseases that attacks the respiratory system. There are a number of diseases that attacks the respiratory system. I know these days, people are suffering from respiratory diseases. And we could be asking a question to ourselves. What causes people to suffer from respiratory diseases? One of the major things that causes respiratory diseases is pollution. Our air is being polluted. And once the air is being polluted, they increase a high risk of having many patients or having very many people who are suffering from respiratory diseases. Students, today I want to share with you one of the diseases that attacks the respiratory system. And respiratory system is affected by many diseases. Very many diseases, very many disorders that attacks respiratory system. If I talk about the respiratory system, specifically I'm talking about the breathing system, where we talk about the lungs, the parts that are involved in the lungs, and some of these are caused by microorganisms, disease-causing agents. Some they are caused by microorganisms, fungi, bacteria, without forgetting the viruses. And others are genetically. They can be inherited. Some we normally inherit the disease from our parents. From our parents, from our ancestors, we normally inherit the diseases. So some of the respiratory diseases can be inherited. And the most common respiratory diseases are, we have tuberculosis, we have asthma, we have pneumonia, we have bronchitis, we have whooping cough, we have common cold, we have the influenza. Students, let us go through these diseases that attacks the respiratory system. And I would like everybody to be able to know what are respiratory system diseases that attacks our respiratory system. We have a number of them. Let us go through them. I said the respiratory system is affected by many diseases and disorders. And once they attack the respiratory system, they cause malfunctioning or poor functioning of the respiratory system. And some of these are caused by microorganisms. If I mean microorganisms, I mean a disease-causing agent, pathogens. Any disease-causing agent, take an example like bacteria, can cause a disease. And while others are genetically, some they are caused by genetically, you can be inherited from the parents. And the most common respiratory diseases, we have tuberculosis, as I mentioned, tuberculosis, we have asthma, we have pneumonia, we have bronchitis, whooping cough, common cold, and influenza. Let's start with the asthma. I know in Rwanda we have very many patients that are suffering from asthma. And asthma is a disease that involves what you call breathing problems, when a person is not breathing smoothly in a way that he should just be able to breathe. And that one is asthma. And most of the time, asthma is allergic. Maybe you're allergic to coldness. Maybe you can just be. It is a disease that comes about when the air passages in the lungs are suddenly being narrow as a result of contraction of their smooth muscles. Once the smooth muscles are contracted because of being narrowing, so breathing becomes to be a problem. You no longer breathe in a smooth way. You breathe when it is very hard because the smooth muscles of the lungs have been contracted. As also mentioned, it is also characterized by inflow of mucus, which clogs. After clogging, that is clogging and the narrowing of the passages and even more. Some substances can be triggered as asthma attack. And they can just be allergens. Talk about allergens. These are something that can cause someone to suffer from asthma. They include, what are those allergens that can cause asthma? We have pollen grains. We talk about some types of protein milk. When you take some milk, which is a protein milk, you become allergic to it, to the milk, eventually you can suffer from asthma. We have pet hairs. Some of you have animals at home. Take an example, cats, dogs, and you find you're allergic to those pet hairs. And even some of the people are allergic to dust, and even to what you call flavors in food. When you have a flavor of a food, you become allergic to it, and eventually you suffer from asthma. And can also be caused by a stress and even anxiety. Stress and anxiety, when a person is being stressed or when a person is being anxiety, you become anxious of something. That is when they are hormone produced, which is called adrenaline hormone. Too much production of adrenaline hormone can cause stress and even anxiety. And that one a person can suffer from asthma. In some families, the disease is also inherited. You can also inherit it from your parents. What are the signs and symptoms of asthma? One of the signs and symptoms of asthma is difficulty in breathing. And we mentioned about difficulty in breathing. Breathing can feel so difficult or quick that the patient can even faint. When a person is breathing, you find it becomes to be more difficult to him or her. We have what we call hissing sound and even breathing. When someone is breathing, there's what we call a hissing sound. The air is not passing through, smoothly in bronchioles and even in the air passages. So eventually, a person starts hissing. Prevention and treatment. Asthma is treated by two types. What you have, what you call taking medication, that is long-term control, and even quick relief medicine that helps to reduce airway inflammation and even preventing asthma symptoms. You can take medication. You can also do what you call quick relief medicine that helps to reduce air inflation. I know some of you normally use that one. That one is referred inhalers. People who are suffering from asthma, they move with that instrument, which is called inhaler. And asthma patients should just be advised to carry the inhalers that contains drugs which pacifies the condition, So inhalers is one of the instruments that contains drugs which pacifies the condition. So asthma patients should just be moving with the inhalers. Let's talk about bronchitis. Bronchitis is a disease that attacks the bronchioles. And this is an infection of the inner walls of the bronchi. Once the inner wall of the bronchi is affected, it is caused by bacteria or air pollutants. As I mentioned it, many people are suffering from respiratory diseases because the air we are taking these days is not healthy for our body. It is polluted. So air pollutants, such as air which is contaminated, and even people who are smokers can be easily suffer from what we call bronchitis. We have two types of bronchitis. We have acute bronchitis, and we have chronic bronchitis. These are two types of bronchitis, and our bronchitis, I mentioned, it is a respiratory disease. As I mentioned, the acute bronchitis starts quickly and stops after a few days. The symptoms of the acute bronchitis is like of what you call cold, feeling cold, and you don't breathe properly. That one starts slowly and lasts for a long time. That one starts very quickly but lasts for a few days. But that one starts slowly and can just last for a long time. And it is the most serious kind of infection, and it is commonly caused by smoking and even pollution. Pollution and even smoking can be one of the agents that can cause chronic bronchitis, and which is a respiratory disease. Signs and symptoms of it: secretion of excess mucus, and if there is excess mucus that are being secreted, they normally clog and they stop the passage of air into the alveolar sac, which is going to be acting, as we know, alveolar sac is the basic functional unit of the lungs. We have coughing. Most of the people, if you find a person is seriously coughing. And the last one is difficulty in breathing. How can we prevent bronchitis as a respiratory disease? Acute bronchitis is treated by simple measures, because that one it starts very quickly and lasts for a few days. But that one starts very slowly and lasts for a long time, the chronic one. So how do you get it? Get plenty of rest. You have enough rest. You take enough rest. Eventually, you drink a lot of fluids, that is involving juice, involving something like water, and even you take what you call cough therapy. You take cough therapy. I know some of you, when you go and visit in pharmacies, you are able to access this cough therapy, and you are able to get relief from acute bronchitis. We have people with chronic bronchitis should take antibiotics, which is quite different from the acute one. This one, chronic, a patient should be able to take antibiotics every time they have a cold with a fever. Next, people who are suffering from chronic bronchitis is advised not to smoke, but smoke is one of the agents that can lead into a chronic bronchitis, whether direct or passive. So people, you can smoke either in a passive way. When you're staying with people who are smokers, you are likely to suffer from chronic bronchitis. Or when you're a smoker, you're also likely having a high risk of suffering from chronic bronchitis. The last one, avoid polluted air. You try to avoid polluted air, and eventually maybe people who are working in industries, they're likely to suffer from what you call chronic bronchitis. We have another one which is called emphysema. Emphysema is another respiratory disease. This is a result from long and untreated bronchitis. When bronchitis has been taken a long time without getting a treatment, without treating it, a person will suffer from emphysema, where the bronchioles in the lungs become blocked. The bronchioles that from what you call goes to the alveolar sac, because we have bronchi branches from what you call bronchioles, and once the bronchioles that carries oxygen into the alveolar sac to be stored temporarily, to be able to be loaded in, to be combined with the hemoglobin and form what you call oxohemoglobin. Eventually, once they are blocked, this causes a damage to the delicate walls of the alveolar sac. Once the walls are blocked, what happens? Automatically, what will happen, it will cause the damaging to the delicate walls of the alveolar sac due to the high pressure when coughing. How would you prevent emphysema? Emphysema is treated according to the severity of the symptoms, how it is severe, how it is dangerous. That's how we have to treat it. We have bronchodilates, or normally given to help relieve cough and even shortness of breath and breathing problems. So you can take that medication, as I can try to underline what you call bronchodilators. Bronchodilators, the medicine that can take and can help you to prevent emphysema. We have pneumonia. I know some of people are suffering from pneumonia. Pneumonia is an infection of the lungs, and it is caused by bacteria. And that bacteria is called pneumococcus, that spreads through the air. In the air, we can have that bacteria, which is called pneumococcus. And that pneumococcus is one of the bacteria that causes pneumonia. And it can also be caused by a virus or a fungi. What are the signs and symptoms of pneumonia? Sudden chills and even high fever. There is what you call chilling and high fever. Rapid slow breathing and even sometimes wheezing. When a person is breathing, you find is wheezing, the air is not moving smoothly in the lungs. We have what you call coughing with a yellow or greenish color or mucus with some of the blood. The sputum must be having some kind of blood, and even a person will also be having what you call chest pains. How can we prevent that one? You should try to avoid overcrowding. This is why even these days, people are advised not overcrowded, because if you are overcrowded, eventually there is a spread of what you call coronavirus. So even pneumonia can just be spread in places where people are overcrowded, when people are big in number, when people are very many in a small space or in a small area. You should be able to avoid having good ventilation in living rooms, and even that is where you are living, you must be having a good ventilations. The treatment of pneumonia involves curing the infections and preventing complications. It also depends on causative agent, bacteria or viruses or fungi. So you can get the disease, you can get the tablet depending on where the pneumonia is caused by bacteria, or is caused by fungi, or is caused by the virus. So you get the disease. We have tuberculosis, what you call TB. The TB is caused by bacteria called it is called Mycobacterium tuberculosis. The bacteria that causes tuberculosis is called Mycobacterium tuberculosis. The source of the infection may be drops containing bacteria spread from air passages during breathing or sneezing. It can also be caused by infected dry sputum. When a person spits a sputum somewhere, you can be easily suffer from tuberculosis. And in particles in the dust, tuberculosis may be attacked by parts of the body, but they are usually invading what you call, they have to invade the lungs. We can have tuberculosis that invades the lungs. We can have caused by pulmonary tuberculosis. We have another source of infection by drinking raw milk. People are taking milk which is not cooked well. You are likely to suffer from what you call tuberculosis. So it is advised for you to take milk which is well cooked, not a raw cooked meat. Eventually, that is from what you call cows suffering from bovine tuberculosis. You can take milk from cows that are suffering from, because we normally give these cows bovine hormones. So you can take milk from a bovine tuberculosis from raw milk, and eventually you suffer from tuberculosis. Signs and symptoms: tuberculosis of the lungs starts with dry cough, followed by spitting of blood, fever, sweating at night as infection precedes. If there is no treatment, loss in weight can occur, and finally the death of a patient can also happen. Prevention. The patient should be able to consult a doctor, adequate treatment, and get an adequate treatment so that you are able to be treated earlier. Once you know it earlier, you are able to be treated and you can get released from the disease. But if you don't consult a doctor, you are likely to die. Treatments for tuberculosis we usually use involving long-course antibiotics. That is, can just last between 6 to 9 months. And another one is to avoid taking raw milk. You boil milk, or drink what you call pasteurized milk that has been pasteurized. Immunization, you have to use immunization, which is BCG, as a vaccine, especially in children that are under age. They have to be immunized or vaccinated by BCG. You also have to isolate the patient from the rest, because if you don't isolate the patient from the rest of the people, they are easier to be contaminated or be easier to suffer from tuberculosis. We have whooping cough. Whooping cough is caused by bacteria, which is called Bordetella postiricis. The mode of infection is from a person to another through inhalation of infected droplets of air. Signs and symptoms: whooping cough starts like cold, and with fever, running nose, and even cough. 2 weeks later, the whooping cough begins immediately. The whooping cough will begin immediately and will start having signs and symptoms. The patient coughs rapidly many times without taking a breath until one coughs up a mass of a sticky mucus, and the air rushes back into the lungs with a loud whoop sound. Prevention, these are the prevention. Patients should be consulting the doctor. Everything you have to consult the doctor adequately when it is still early. Treatment of whooping cough involves taking antibiotics earlier before coughing feels serious or begins seriously. Immunization with vaccines against whooping cough. The infants have to be vaccinated against whooping cough, and it usually combined with those against diphtheria and tetanus and even poliomyelitis. All these have to get some kind of vaccination. That's why young babies are being vaccinated against these diseases. We have common cold. Common cold is an illness caused by a virus infection located in the nose. And I know some of you have what you call some of the signs and symptoms. There is sneezing, a running nose, nasal obstruction. We have sore and even a scratching throat, coughing, hearness, and etc. These are the signs and symptoms of common cold. Prevention. Cold is caused by a virus, and therefore it will be clear after several days. treatment is mainly to lessen the symptoms. If cold persists, seek for medical advice. Go to the doctor and get for medical advice. And practice preventive measures. You have to practice preventive measures, which keeps cold viruses from entering into the nose. That is why you can even wear face masks. We are trying to put on these days, face masks purposely to avoid the entry of COVID-19. Avoid having cold patients coughing and even sneezing on you or in your direction. When you're coughing, you try to put it on side, look aside. We have the influenza. I think the influenza is the rest, or what you call the flu. I know some of you, most of us, we are suffering from flu, and it is highly contagious disease. And it is caused by infection from the influenza. We have type 1, we have type A, we have type B, and even rarely you can also have C. These viruses infect the upper airways and lungs. The flu is highly contagious. And if you say they're highly contagious, they can be easily spread very easily. The symptoms of influenza can include fever, dry cough, muscle and joint pain, tiredness, extreme exhausted, headache, sore throat, and even stuffed nose. These are diseases. General treatment is general. Complicated flu is managed by simple resting in bed and even taking enough plenty of drinks and fluids, particularly water, and even take over a counter medication to help to relieve from the symptoms. Antiviral medication can also be used to reduce the length of time of symptoms and etc. So students, let's have a lesson assessment. Almost there are 3 numbers. You have to go through those 3 numbers. Suppose you are a nurse patient suffering from respiratory disease. How would you prevent contracting the disease? Number 2, is it proper to avoid friends who are smokers? We talked about some of the disease. Why is it not advisable to take antibiotics without prescription from the doctor? That is a home assignment. You go through that home assignment. And enjoy the rest of the day. See you next time.